practice for many years. I completed my orthopedic surgery residency in 2006 at Harvard, and then performed an additional year of fellowship training at University of Pittsburgh, studying arthroscopic surgery of shoulder and knee and sports medicine. So I've been in practice since 2007, and I'm always learning, always striving to be better, always striving to take better care of the patient and improve the outcome. Surgery is my passion. It's absolutely challenging, it's never boring, no operation is the same, and I strive to achieve the same level of excellence every day in every operation that I do. Seeing the patients in the office as they recover is another rewarding part of the career, but the surgery is absolutely the most rewarding, interesting, possible occupation I could imagine. One thing that's important to me is that the patient understands what the injury is, what the anatomy is, and what the surgery entails. So every patient we bring in to review the x-rays, the MRI, explain the diagnosis, explain the anatomical cause of the pain, and how we're going to repair it. And it's important to me that the patient understands exactly what is going to be involved in the surgery and the recovery so that they can mentally and physically prepare. One of the most enjoyable things about our practice is taking care of multiple generations of the same family. So I treat children, adults, and people up into their 80s and 90s with orthopedic injuries. And it's absolutely amazing to take care of the grandparents and the children, the grandchildren, and then see them grow from children into adults and follow them with all their different sports injuries at different ages. So getting to know the whole family and taking care of all of them is a real pleasure. One interesting fact about me is that I do have a Stanley Cup ring. I had the pleasure of taking care of the Pittsburgh Penguins when they won the Stanley Cup in 2009, which was an amazing experience. Hockey players are incredibly tough and absolutely the most polite, delightful athletes I have cared for over the past many years. And I've had the chance to take care of athletes of all types at college, high school level, professional level, up until master athletes in their 70s and 80s. I took care of a 73-year-old man who was a marathoner, and he had run many marathons with no problems, presented with a meniscus tear, which required surgery, and his biggest concern was, could he run his 73rd marathon? He sent me a follow-up picture months after surgery, finishing the marathon, crossing the finish line, victorious, and his knee was doing great. I still have the picture, and I remember that meant so much to me to know that he was doing well and had healed up from surgery, continued to run. The level of expertise that we can bring to the care of the patient, I think, is a distinguishing factor for our practice, for Piedmont Orthopedics, and for our team here. We have an amazing office staff, amazing x-ray techs. People we work with in the operating room are phenomenal, top of their field. The hospital, the anesthesiologists, and the physical therapists after surgery. All those things are so important to get a good outcome in addition to the best possible surgery we can offer. We set the bar really high. We want every patient to have the best possible experience all the way through and no compromises. We want the patient to feel like they're being treated as if they were a member of our family. And it's important that they get the feeling that I'm taking care of that person just like I would take care of my sibling, my spouse, my children.